Alright. Hey guys, the following presentation is being brought to you by Tidewater Community College student nurses. As you know, nurses play an essential part in providing safe, effective patient care. As healthcare professionals, nurses recognize that medication error is a serious problem and a significant concern for practice. In the pediatric setting, medication errors are more likely to occur and are especially dangerous to these patients. The focus of our presentation is preventing medication errors. As you should know by now, the 5 rights to medication administration are the right med, the right dose, the right route, and the right client. The following scenes are a representation of the various medication administration violations that were witnessed at our clinical setting.
Hey, Jill.
Hey, ladies, what's up? Not much. What are you doing?
Administering medication to my annoying patient.
Oh my goodness.
Like 14-year-old Mexican kid.
Sounds
I know,
fun.
right?
So what'd you do this weekend?
Nothing.
You go anywhere?
Well, actually, I went to the movie.
Oh, that's
Oh,
good.
what movie did you see?
Some Denzel Washington movie or something.
Okay, yeah, that looks kind of good. I've seen the previews. I can't remember what it's called though. What'd you do this weekend?
I went to the Hunt Club. It was cool. It was fun.
I
with my
love that
kids.
place.
Yeah.
That place is so awesome.
Is it open now? How
Yep.
much is patient again?
Let it go.
She can't sing.
Let it
I'm
go.
so tired of hearing that song.
Yes.
Oh my god.
I'm burnt
I
out.
can't believe it.
Can't hold it back anymore.
Can you guys calm down my patient real quick?
Yeah. Let it go.
I
Mom.
gotta go check on my
Oh,
patient.
ladies!
Yeah.
Can you verify his heparin?
That's good.
You got it.
Okay. And, yeah. Oh, let's go. Let's go.
Okay, so can we identify what went wrong here? The errors were caused by distraction from the nurse talking with other coworkers while she was doing it. She didn't put on gloves. She didn't wipe all her vials down. She didn't double check the heparin right. And she put unlabeled syringes in her pocket.
Oh, thank God. Oh, thank God. She's sleeping.
I heard that. Where's my mommy?
Sweetie, your
Mom!
mom's not here yet.
Where is she?
I have no idea.
Why?
I said I have no idea. How are you doing today? Did you eat some breakfast? Straighten up for me. Huh?
No, it
Did
hurts.
you
Don't
urinate?
touch me.
What is this?
It's the ideal. Let's
What
take
is
a
it?
selfie.
Oh, okay.
Okay, thank you.
So,
See
did
my
you eat
SpongeBob?
today? Penelope, did you eat today?
At 8?
Yeah, or when did you last wee-wee?
You
Like, urinated?
can't remember. Do you?
I don't know. That's the first time I see you, sweetie. What is SpongeBob? Okay, I'm gonna administer med, okay?
That hurts. No, where's my mommy?
Your mom's gonna come back. Come on.
No.
Tell you what, give you meds and then we can take more selfies. Is that good?
Yeah, okay.
Okay. Okay, now open your shirt for me. Come on.
Ouch!
Oh,
Mommy!
come on. Take a deep breath. Alright. Alright. There you go. And, okay, I guess you do selfies.
Where's my selfie? Okay.
It's
1,
SpongeBob.
2, 3. Yay!
Okay, you're funny. Alright. Try to get some sleep.
Sleep to your face. Where's my mommy?
Alright.
Okay, so what went wrong here? This was actually witnessed quite a bit during our clinical rotation. She didn't do a patient identification. She didn't ever grab the patient's wrist and verify her name or her date of birth or any of those patient identifiers. The second thing that was actually witnessed during our clinical rotation was that the nurse pulled out a syringe from her pocket that was unlabeled. As you saw earlier, the nurse prepared a couple of syringes. She didn't label them. So who knows if that was actually heparin that was given to this child or if it was even her medication. So there was a lot of mistakes seen here.
Hey, how are you?
Good.
How are you doing?
Good.
How's he doing?
He's doing all right. He finally got some sleep. He's been having
that's
trouble.
Good.
So he's resting peacefully now.
Okay, I'm about to give him some medicine. My mouth.
Can we just let him sleep for a little while longer since it's been having such a hard time?
Oh,
Yeah, can you just leave him here with me and I can give him to him?
sure, that would be nice. This is his medicine, just one.
Okay.
Make sure he takes it when he wakes up, okay?
Sure.
And I think he's allergic with orange juice, right?
Yes.
So don't take it, just water.
Okay.
Okay, I'll be back.
All right.
Okay, check up on him.
Okay.
All right, have a
Thank
good day.
you. You too.
What went wrong here? The nurse is not identifying the patients once again, and also the nurse is just leaving the medication to the parents. They didn't do any assessments before giving the meds, and also there's no side effects explanation or what is the medicine for.
Alright guys, it's time for post-conference after clinical today. Our focus this morning was to focus on medication administration. Is there anything that you guys want to talk about?
Well, with my patient, I saw the nurse come in and give meds that were not labeled. They were syringes she pulled out of her pocket, and she didn't identify the patient. She just gave the meds, and that was what she did.
So she just pulled a bunch of syringes that were filled with medication out of her pocket, and she just gave it to the child.
Yeah.
Okay. Do you know what medications they were?
One was phenobarbital, and the other was lactobacillus.
Okay. Now, if you were that nurse, what would you do differently?
I would have identified the patient. I would have labeled my syringes when I actually drew them up instead of just putting them in my pocket and assuming,
Yeah.
that's what I have in my pocket when I gave it to the patient.
Yeah, because what if you had multiple syringes from different patients and you give the wrong med to the wrong patient? That's really, really scary.
Yeah.
Anything else?
Verification process, like that double checking a medication dose. They were literally doing it from across the room, like yelling. Well, not yelling, but like, hey, come check this. Like, okay, it was for this patient. Over how much? Okay, that's good.
So they were acting out the process.
Acting out the process, but I don't think that amount of distance is sufficient enough for me to verify, for them to verify if it's the right medicine and the right dose.
So what would you do differently if you were that nurse that was wanting another nurse to double check for you? What would you do?
Be a little closer. Get into each other's space. Well, not.
Anything else?
Yeah. Also today, I witnessed a nurse leaving the meds inside patient's room. I mean, leaving the meds to the parents, that's not safe enough.
No, that's not safe. And why is that not safe?
How do you know if the parents are really giving the meds to the patient?
Selling it.
Yep.
Or
Yeah.
taking
Maybe
it.
selling it or taking it home. Safety is the first priority.
Yeah. Yeah, and then the nurse is also not doing an assessment or evaluating how that medication is working
And
on the
also
child.
teaching to the parents if what are the side effects of meds and stuff like that.
Yeah, that's very scary.
Yeah.
So we would never, ever, ever leave our medication with our patient's parent or at the patient's bedside. I think that's, yeah. So I think today that what we saw a lot of was distractions. We need to minimize on the distractions, make sure that medication administration is a focus. Keep your patient safe.
Yep.
And nurses need to be aware, like, okay, she's preparing all the meds, leave her alone.
Yeah.
Talk to her after.
Yeah.
Privacy.
Yeah.
Yeah, I agree.
Because that's a distraction.
Yeah. All right. All right. So I think this was a good post conference, guys.
Yeah.
All
I learned
right.
a lot today.
Good. I'm glad you did.
Thank you. I need to go to the bathroom.